Dominic, thanks very much indeed. Faris and Henrik, congratulations and thank you for the invite. I bring great greetings from the East Midlands to you all, and it's my brief really to talk about custom stems. Is there a role for them? Those are my disclosures that are not relevant to this presentation. I think it's important to understand that just because things get a little bit more complex in primary hip surgery, it's essential that we maintain our goals to get the perfect outcome for our patients. We want to get reliable pain relief, accurate restoration of hip biomechanics, but at the same time with these more complex cases, we need to correct and accommodate for the deformity. We need to manage retained or indeed incorporated metalwork. We need to make sure that we get sound fixation against the bone that is often compromised, and we need to manage any soft tissue concerns. We also are operating on young patients, and so our reconstruction must be revisable and durable. Now, many of these cases are they're really sort of extended normal anatomy in mild deformity, and some of the more complex cases indeed can be managed really with more standard implants, as you can see. Again, by using those standard implants, standard fixation, we can accommodate for the deformity. But these are fairly complex cases. They require experience, planning, careful technique, and indeed the correct instrumentation. I would advocate that in many of these complex cases, there is a very definite benefit to considering cemented fixation. Here, a guy in his 40s with infantile osteomyelitis, no functional hip replacement, a significant deformity, managed really with cement to get good fixation and deal with deformity and a good outcome. Similarly, we can use off-the-shelf components to deal with modular components that can deal with deformity here, a relatively high DDH complex case that can be managed with off-the-shelf components, as you can see here with this, dealing with that deformity and yet maintaining and restoring good hip biomechanics. In terms of how we manage severe femoral malalignment, that depends an awful lot on the degree of the alignment, depends on its location and of course the magnitude. Our options are to correct and perform reconstruction, and we can do that either simultaneously or we can do it as a staged procedure, having got the alignment correctly. We can consider custom implants, which is what I'm going to talk to you about, or sometimes there needs to be perhaps some slightly more imaginative options, as you can see here in this case, where we used a hip resurfacing to deal with that very complex, more proximal femoral concern. Here we have a case with significant deformity. Our options are to carefully go about designing an osteotomy, as you can see here. We can then stabilize that osteotomy and effect reconstruction with different types of stems. A standard stem, a long monoblock stem, or indeed we can use more modular revision type components. The alternative with that sort of case is to see things differently. To look at the deformity, to do a CT scan that will allow us to look at the length, to look at the rotation, and to look at that deformity to see whether we can actually accommodate that and design an implant that will allow us to deal with all of those things and still get a good functional outcome. We can come up with a plan that allows us to get good host bone contact and a technical plan that allows the surgeon to do the procedure, and we can come up with some slight unusual looking, and in this case uncemented components to allow us to do the job. So here an interesting case, a 65-year-old doctor who had a previous fracture and malunion, as you can see. The easy thing is always to do the straightforward side first, you see, to build confidence. So we've done a very straightforward job on one side. And we now move on to the more complex contralateral hip. Now, of course, our options again were to think about doing an osteotomy and then using a revision type component to stabilize around that. But could we use a custom stem to deal with that deformity? So here we are again. Patients had a CT scan. That CT scan's allowed me to look at the rotational profile, to look at the deformity, to look at the leg length, to look at the bone availability. We can come up with a design that will allow us to accommodate that deformity and yet still get the biomechanics absolutely right, which is of course what we're looking to achieve. We can look at where the component is going to contact host bone, where the bone is good. We can look at the cross-sectional diameter of the femur itself to make sure that we can get good contact with our component against that. And we can look then at a guide that allows the surgeon to make sure that during the operation we can put everything where it's supposed to be. We can design the net cuts to get the components where we want to have them. So here we are intraoperatively. There's all of my plans up on the theatre wall. We're using a Midas Rex burr and some other sort of little devices just to get through the sclerotic bone to make sure that we can start to develop the canal. And we then have this very unusual looking aggressive rasp with a significant curve into it. And we start to introduce that into the femur. And I would say to you, these are pretty challenging cases. And in the first couple of moments, you have absolutely no idea whether that device is truly going to go down into that bent canal. But it's a matter of really using the Star Wars force. And with time and a little bit of patience with a Midas Rex burr at the top end, we can gradually introduce that aggressive burr down into the custom femur. As you can see, it goes down right the way through until we get it down to exactly where it's supposed to be. So we then get to a situation where we have our component. You can see, again, a very unusual looking component. But again, that can be introduced very carefully, full in the knowledge that we're getting excellent host bone contact with that uncemented HA-coated implant. And here we are, and our post-operative X-ray acutely has to be one of the more unusual looking lateral X-rays that I've done with a primary hip replacement. There we are immediately following surgery, and here we are 18 months following surgery. You can see how that stem hasn't moved a millimetre, solidly integrated, and the patient doing very well with good hip biomechanics. So here's some other cases really with some challenging problems that can be dealt with in a similar way with these custom designed implants. Here we are with our post-operative X-rays, again, sometimes unusual looking implants, but good outcomes and a very reliable way of dealing with these problems. If we look at the results, there are a number of papers out there, this one from Marseille in France, where they looked at a relatively large number of these components over a considerable length of time. Again, you can see with a very high level of overall implant survivorship on the femoral side, and with good functional outcomes in complex cases. If we look at the National Joint Registry, there have been 365 of these stents put in to December of 2018, an increasing frequency. They're being done in more complex cases. 4 deaths, 3 revisions recorded, 1 for dislocation, 2 for loosening. A very low incidence of calcar cracks, femoral perforations, which I think plays to the carefulness of the design. Again, we've shown already that the outcomes compare very favourably with other uncemented implants, both in terms of longevity, but also in terms of patient-reported outcomes and satisfaction. So in summary, when we look at custom stents, is there a role? Well, I've already described some of the other options that we have to deal with these problems. We have to plan carefully our surgery. Again, I would think that cement does have a role to play, and it's important that we understand that. With regard to custom stems, they're versatile, if technically challenging. With careful attention to detail in design and planning, they can work, they're expensive, but I would say they're effective, and we're seeing some encouraging results. So, ladies and gentlemen, I would argue that custom stems most certainly do have a role. Thank you for your attention.